Hi everyone, this is October, which is Breast Cancer Awareness Month. I'm Dr. David Sayah, a plastic and reconstructive surgeon in Beverly Hills. It's really important for me to let you know that I was a general surgeon before I specialized in plastic and reconstructive surgery. So I've been on both sides of the breast cancer treatment. So I've done hundreds and hundreds of mastectomies and lumpectomies in women, and now I get to reconstruct them after they've been treated for breast cancer. So I've got lots of experience in this field, and I want to share my experience with you. We've already talked about the prevention of breast cancer. Now I want to talk to you about the diagnosis of breast cancer. As I mentioned to you before, it's really important for all women to do self-examination in the shower. We can talk later about techniques for self-exam. So do your self-exams once a month, and it's really important for women 40 and over to have their annual mammograms. If there are any abnormal findings on mammogram, ultrasound, or on self-exam, your doctors may recommend further examinations or close-up examinations using ultrasound or MRI. If there is something which is even more suspicious, at that point, they may recommend needle biopsy of the masses or even an excisional biopsy so they can take a closer look. Now, it's really important to know that most of the masses that you might find on self-exam or on mammogram will be benign. Most commonly, it's fibrocystic disease, which means just fibrous and cystic disease within the breast. In those cases, they may ask you to come in and do another follow-up examination like a mammogram or ultrasound in about 6 months to see if the cysts or the lumps have gone away. Sometimes the lumps are even associated with your menses or your period, and they may get smaller or go away after your period. So those are also benign, but please don't take them lightly. Follow up with a doctor, and you're of course welcome to come to my office and we'll be happy to examine you. Now, one question which often comes up is, what if I have an abnormality on my mammography and I've had breast surgery in the past? Breast surgery might include breast augmentation, which is extremely common, breast reduction, breast lift, or even fat grafting or autologous reconstruction of the breast using your own fat. In those cases, it can be related to your prior surgery. It can be scar tissue within the breast tissue that resulted from the surgery, particularly with fat grafting. So in those cases, again, your mammographers should be able to diagnose those carefully with additional tests. Or again, please come into my office. I'll be happy to examine you and we could chat about your options. Thank you.